Welcome back to AM Northwest. It's the most popular plastic surgery procedure and a way to get either what nature didn't give you or to fix the toll of time and gravity. Here to tell us more about breast augmentation, please welcome back from the Gorin Plastic Surgery and Med Spa, Dr. Aaron Gorin.
Thank you.
And also, I will say, as a breast cancer survivor, it's to take care of things that you lose for whatever reason.
Of course.
So let's talk about the variety of styles that you have out there, because there is a lot out.
Right.
A lot out there.
There's basically two main styles. There's saline silicone. There's the saline, which is this guy here, and there's sort of salt water inside with this tube attached to it. And then there's the silicone, which is this guy here. And the silicones were pulled off the market back in '92.
Right.
Put back on in 2006 because the new implants are much stronger. These guys, you could really give it a good squeeze and see how tight.
Because we were worried about leaking.
Leaking, exactly. So the old silicone was much more watery in nature. The silicone inside here is what's called a cohesive gel. So you could stick these with 1,000 needles, nothing happens. Cut it in half, nothing happens. So it's a much safer device. And in my practice, I'm pretty much almost 100% silicones.
Okay.
Lastly, the newest implant came out last year, which is the so-called gummy bear implant. You can take a feel of that one.
Gummy bear implant?
Yeah, gummy bear implant. And that's because it's a little firmer to the touch. This one is to sort of minimize the amount of fullness that's up top to give a little more natural look. It's the newest implant. It's not the best. Even with that, still the silicones that we currently have are still much more common.
They're the best. When it goes to picking out one, how do you decide? How do you decide whether it's saline, silicone, or the gummy bear one?
A lot of it is patient dependent. In my practice, most of it is the silicone implants themselves. A lot of it's based on anatomy as well. Some patients that come in that are still really nervous about the silicone back from the late 80s into the 90s, they might choose the salines.
Okay.
But the silicones have a much softer feel and a much softer look.
Who's a good candidate?
Well, I think people that come in that have either want to be larger just in general, or sometimes they might need to be larger and need a lift, or need a reduction, or a combination of all those. So it all depends on their personal goals.
Like a lot of women who've had children, pregnancy takes its toll.
It absolutely does. The pregnancy and breastfeeding can sort of change the shape of the breast, and we can certainly reshape that back to where it was before surgery or before pregnancy, or even better.
What are some good questions if you're contemplating doing breast augmentation? What are some good questions to ask your plastic surgeon?
Well, one of the most common questions I get is, how long do they last? And patients used to be told replace implants every 10 years. Not so anymore. I think as long as patients are followed on a regular basis, there's no reason to think that these would ever need to be replaced. But statistically speaking, most women end up with another procedure later on down the road. Could be 10 or 20 or 30 years later. But the implants, in my opinion, really should last indefinitely.
What if women are thinking they want a breast augmentation, but they're thinking about having children in the future and they're worried about breastfeeding?
Great question. I'll tell patients that breastfeeding really shouldn't be affected with the straight breast augmentation, although certainly the breast shape can get changed with pregnancy. And so if they're planning on having kids in the next year, I say wait. Otherwise, may as well proceed and enjoy it.
And what are the risks and complications and possibilities?
The most common thing that I see is an implant that is sort of out of position a little bit, just a little too high. Nothing that's really unusual looking in clothes, but topless you can kind of see that, and that might be 1 or 2%. In my practice, I don't charge anything for revisions, which is a little bit unique. We're able to control costs because I have my own surgery center in the office.
Oh, fantastic!
So it's certainly it's my most common procedure.
And you have a mommy makeover special going on.
We do, yes. It's mommy makeovers include the breast surgery as well as tummy tuck, liposuction, and that's $500 off if booked by the end of the month.
Okay, and the number is 503-692-7222. We'll put all information on our website at katu.com. Thank you very much, Dr. Gorin.
Thank
Good
you.
to see you.